Hey everyone, a quick note before we begin. Just a few days after we recorded the conversation that you're about to see, we learned that 6 major medical organizations, including the American Academy of Pediatrics, had filed a lawsuit against the U.S. Department of Health and Human Services and its Secretary, Robert F. Kennedy Jr., for changing federal policy when it comes to the COVID-19 vaccine and pregnant patients. This is an evolving story. It broke after our recording. What we do cover in this conversation remains relevant to frontline clinicians, and it's all about navigating changes to vaccine policy, availability, and affordability in this time of great change.
Hey everybody, this is Saul Behar, host of Hippo Education's Peds Rap podcast.
And this is Neda Frayha, host of Hippo Ed's Primary Care Rap podcast.
Neda, I don't know about you, but on all my social media pediatric groups I belong to, the podcast listeners I hear from, and clinician friends I chat with, there is this enormous buzz of worry and anxiety at the levels of dropping trust in the institution of medicine as a whole. The latest blow has been the removal of all 17 experts from the Advisory Committee on Immunization Practices, otherwise known as ACIP, and everyone seems to be in a bit of a panic.
Yeah, Saul, I think it's been just a very, very bizarre time. I know that my colleagues and I are feeling anxious about it. Also, it's exhausting to think about the uphill battle of helping all of our patients separate fact from fiction when there is a lot of misinformation around us. With those ACIP changes that you mentioned, and also I'm thinking about what a difficult, devastating flu season was behind us in 2024 to 25. How are we going to navigate this coming winter if we're not sure which vaccines will be available or affordable to our patients?
Right. And more broadly, what can we as individual clinicians do to regain the trust of the public, our patients, and the parents? Well, within the specialty of pediatrics, we are lucky enough to have the American Academy of Pediatrics behind us. They've been doing incredible work to educate the public and promote factual evidence-based science in terms everyone can understand. And today, Neda, we are so excited because we're going straight to the top. We are honored to have as our guest today Dr. Sue Kressly, current president of the AAP. Thank you much, Sue, for being here.
Thanks so much for having me.
Sue, tell us, what is your take on what happened, why the public trust in medicine is just not as robust as it used to be?
So let's start with your listeners reframing the fact that we haven't changed, right? We are still the people who went into medicine to help our community to thrive and be healthy, and partner with our families to make sure that they have the best chance of that happening. And so we have to check every morning. I wake up and say, I'm still the same person. I still took my Hippocratic oath. I still am dedicated to the health and well-being of every child, no matter they are. Okay, so now what? Now where do we go? Well, lots of things have changed around us, right? Information travels at the speed of a social media post and gets liked and shared and amplified because other voices can be amplified, often more eloquently than we're not trained social communicators. We do it in an exam room one-on-one really well, especially as pediatricians. We have to explain things to 3-year-olds and 13-year-olds and parents and grandparents. So we're pretty good at relating one-on-one, but we haven't really studied, or it's not in our bailiwick for many of us to really look at how we get our messages across. And so the world has changed around us, and I think that means there's an opportunity for us to move with it and really leverage what is happening. But at the cornerstone of why did we go into medicine? Because it's this bi-directional relationship with patients and families at some of the most vulnerable times in their lives, to get them through and witness and be with them when they need us most.
We touched on the Advisory Committee on Immunization Practices, or ACIP. Sue, can you tell us what is ACIP and how does it fit into how we have access to vaccines?
Yeah, so the ACIP is really a convening of multi-stakeholder experts. And, the three of us who are physicians understand that this science around vaccine is so incredibly specialized that I sort of feel like it's the equivalent of neurosurgery, right? Like, don't ask a general pediatrician to open up your brain and do something, because I'm happy to move and get out of your way, but that's not my expertise. Vaccinology and immunology and the science behind looking at the data is so intricately specialized that it is a group of people who represent all of the appropriate stakeholders to really look at what the science tells us about infections and vaccines and how to make the best recommendations for the entire country and population so that we can keep them protected from vaccine preventable diseases. So the committee of experts that made up ACIP, those 17 people, took their responsibility incredibly seriously. And so when the 17 people were abruptly terminated and then replaced with 8 people who do not represent that expertise and do not have that expertise, instead of taking the science and shaping policy, they came with an agenda of policy and then are trying to shoehorn the data and the science to support what they had already decided was going to be the outcome, which to the scientists in the room is just mind-boggling. We really need to go back to what we had, which was a functional, multidisciplinary stakeholders with multiple liaisons in the public domain, transparent, based on science, all of those things. That's not what we have.
So, Sue, what is the actual connection from this ACIP committee to what gets approved? And I think also importantly, what gets paid for in terms of vaccines?
Yeah, so let's connect a lot of the dots here between ACIP and the entire vaccine infrastructure, if you will. So let's be clear that there is a lot of statute, some of it federal and some of it state level, of ACIP decisions and what happens to them. The CDC director still has to approve the ACIP recommendations. That sets off a couple of chain of events. First of all, there is legislation that health insurance plans have to pay for vaccines that are recommended by that process, that ACIP and then approval process. And so that is true of public payers like Medicaid and Medicare, and also private payers and ACA plans. And so the insurance companies by law have to then, by statute, have to then pay for them without cost sharing to patients, which means that everyone can take advantage of the preventative life-saving success of vaccines. This has a specific additional hook for pediatrics because, as you know, 50% of kids in this country are covered by Medicaid or CHIP, which is covered under the Vaccines for Children program, or VFC, and the government funds those vaccines that are recommended through ACIP and approved for the VFC program. And so the VFC program is not just Medicaid and CHIP, it's also for underinsured and uninsured children. That was written on purpose to really make sure that there is no child left behind and able to get vaccines. If ACIP changes what it recommends, we have 2 significant issues here. One of which is that, does that mean that the federal government will stop paying for VFC vaccines that are not recommended by the ACIP process? And will private insurers decide that they shouldn't pay for it? Now, it is way cheaper to buy for a vaccine than have someone on a ventilator or in an ICU. So to me, it's short-sighted to not pay for this in any way. But there is ACIP decisions and approvals that is hooked to the payment infrastructure, the VFC delivery infrastructure, and many states have adapted what ACIP recommendations are for their school-based entry requirements. And we know that one of the ways that we get communities covered is that we maximize the community's coverage of vaccines is through school requirements. And we know that school is one of the places that kids congregate in large numbers. And so that if there's one index case of an infectious disease, it spreads pretty quickly to kids who are also vulnerable in the school setting and can't be protected for medical reasons.
So is there any sort of preemptive activity that the AAP is taking, or anything that we can do on a sort of bigger level in that case, like where there's a contradiction between what ACIP says and what AAP says we should be doing with vaccines?
Yeah, so let's unpack this into two pieces. First of all, I would encourage every physician to work with your state medical society, and for the pediatricians, it's your state AAP chapter, to figure out where in your state law ACIP is hooked. There are some states who have watched this happening, and they've instituted statutes that's getting ACIP written out of that language. But I also want to be clear about what the AAP has been doing since the 1930s. Since the 1930s, the AAP has their own experts that review the same data and literature from the pharma and vaccines and epidemiology spread of diseases to come up with our pediatric, what I'm calling the pediatric gold standard immunization recommendations. And I want to be clear, and I want your listeners to be clear. Don't call this an alternate process or an alternate schedule, because that triggers what we've all dealt with parents wanting to come up with their alter. This is the AAP's science-based gold standard pediatric vaccine recommendations for children. We've done it since the 30s. We're not going anywhere. What most people don't realize is, because we've been doing it since the 30s, by and large, because we've been working with CDC and other experts and stakeholders, it has completely harmonized with the ACIP recommendations. People forget that we have our own AAP process because it's been the same recommendations. So what I'm saying to people is, we're not changing what we're doing. They might be. But that just means that the gold standard pediatric immunization schedule, we have to amplify our voice at the academy and say, no, it's us. We're the people who followed the science. What we say is what kids needs. And so we're having conversations behind the scenes, in front of the scenes, with anyone who will talk to us, with payers, with state chapters working on efforts in their state and lifting up our voices. And I think healthychildren.org is going to become more important than ever. And so we're going to amplify our outreach through every way we can and draw people to us. We become the beacon of light and the trusted source of truth for pediatric recommendations.
When I think about what keeps me up at night, it's what you just described. It's that erosion of trust, and also my patients not having access to the vaccines they need, and also me not knowing where to turn for information if my trusted sources are now, I don't know if they're legitimate or not. I'm so grateful that you told us about resources like, of course, the AAP, for example. On an individual basis, me in my primary care practice, what can I do to help reestablish that trust from my patients and my community if it's being eroded at a systemic level?
Yeah, this is tough, and I think it's going to take more than us to restore trust in medicine as a whole. The good news is twofold. Most patients still trust their doctor. If they don't trust maybe organization or government or whatever, medicine is still a relational experience, right? And so having a relationship with someone and being in a space with empathy, we have to be very careful that we don't take our anger at what's happening and our activated advocacy into the exam room, because families didn't cause this problem. They are counting on us to give them the best advice. So I think we have to be careful about screaming where it needs to be screamed at people who are policymakers who are eroding the trust, and then use our empathy genes in the exam room to meet families where they are. And I had my kids decades ago. I can't imagine how overwhelming it must feel to be in a place where you just don't know where to turn, and you want to hide in your room and shut the door and don't know who to listen to. And so I think we have to earn their trust back. That means that we have to sit and listen and with empathy meet them where they are and be credible, which means that say to them, I'm going to take this journey with you right now. We also have to, our health delivery system is built to not let us do that. So much of medicine has become transactional. See more people, do more stuff, get more billing, all that stuff. You can only spend so much time. We got to push back, because if we're going to keep our patients healthy, they need to give us time to be in that space, and they need to let us develop relationships with families, because when families come to you for other things and you've built their trust because you helped their kid with an asthma attack and they were scared to death, they are then going to turn to you and you are a much more credible voice. So we have to meet them where they are. I think we also have to meet them in the community, right? Like go to volunteer to be as a pediatrician at a daycare. Let you drop your own kids off and say, I'm here to just do a question and answer one day for an hour from families who have questions. Go where they are. There is this power dynamic that happens when we make people come to our offices on our schedule, undress them and do all kinds of stuff. That's this power dynamic that we have to be very careful that we don't use that in a way that they feel shamed or not seen, heard, and valued, or they feel like we are speaking down to them because how dare they be co-opted by non-science. We have to meet them where they are, and sometimes that's going to take us being a little creative and taking the time and finding ways to have those conversations that are not just in the heat of the moment.
It's funny you say that, Sue. I find myself on social media sometimes the frustration comes out and you say something that's like, oh my gosh, I can't believe this is happening. How could people fall for this, what seems like total silliness? But they don't have the same information that we have. And it's a really big challenge. And my next question to you is like, how do we keep our professional cool when there is a simmering anxiety, outrage? Like it's all there. And in our groups online, we talk to each other about it. But how do we present a calm, even keel face to the public and to our patients?
Yeah. So I think there's three parts of this. We have to take care of ourselves, which for me means sometimes I go for a walk on the beach and scream, right? Like really scream. I meet my colleagues in meetings and places or have conversations like this where I can dump all of this stuff, and because I feel seen, heard, and valued by you because you get me. I don't even have to tell you, like it feels very validating. But then I pretend that the rest of the world is either like I'm dealing with a toddler or a teenager. And I can't add my own emotion to the conversation or I'm never going to end up where I need to be. And so I have to check my own emotions first, remind myself who I am, that same person who took that Hippocratic oath to care for every kid, and what I'm trying to accomplish, which is that every patient, every community gets to take advantage of the life-saving and success story of vaccines. And so how do I become that voice of reason? Some of it is educating and connecting dots. We also, I think, as physicians have spent way too much time talking amongst ourselves instead of talking to others in the community, because policymakers don't have, we sometimes go like, oh, that's not our domain, we should stay out of it. No, I think we have an obligation to make sure that they understand and use those skills that we have to take complex medical problems and explain them in a way that is not talking down to our patients or our policymakers, but is plain language of what this means. And it's both with data and stories. People remember stories. So, what pediatricians are worried about is when I trained, I won't tell you how many years ago, a couple of decades ago, we saw hib meningitis. I went to funerals of kids who died from meningitis, from epiglottitis, from horrible things that we now can prevent. And my young colleagues go like, Sue, I've never seen that. I've only read about it in the book. So we have that backstory. The policymakers do not. They don't understand that when you get woken up in the middle of the night of a kid who's got a fever, if they're fully vaccinated, my head goes to reassurance. If they're not, my head goes to, oh my God, what could this be? This could be life-threatening. Call an ambulance. I mean, it's that night and day different from a kid who's vaccinated and a kid who's not. And so we have to do our best to explain that to people who don't live inside medicine.
So, Sue, I often struggle myself with how I should present myself to the public in terms of social media. We all have these outlets where we hopefully are people who are respected and our opinions are important. What's your ideal way that we should present ourselves as primary care, pediatricians or specialists for kids to the social media world?
I think a couple of things. I think we have to be human, empathetic, and come across as relatable, which means we have to check our own emotions and make sure we're in a good frame of mind to make a message. I think we have to point people to reliable sources that we will know continue to be reliable, so they will keep going. So sending back to healthychildren.org and to the AAP fact check, so that and to do so in a measured, calm, reassuring voice. And then I think that we have to remember to do it from the lens of the receiver, and empathy is not in the mind of the deliverable. It's the person who's receiving it. So how do we use that empathy and lead with, we want to partner with you. You are the best expert for your child. We want to partner with you, and use your child together. We can figure out what science tells us is the best way to keep your child healthy, and try to take the emotional piece out of it, and be empathetic, factual, credible, and lead them to the right places. But I also think this message, we cannot create one message that resonates with everyone. We serve different populations. Even in our own practices, there's subpopulations. What we say to one group of people is not going to resonate and hit home the way it may with another one. So I think we also have to have nuanced messages and be careful about who we are messaging, who the receiver of the message is. And then we should partner with people who already have a trusted voice within that community. And so if you can find someone who already has a social media following that you want to reach, do something together or amplify each other's voice. I don't need to be the messenger for a lot of what happens if the message reaches and lands and gets us what we want, which is for every child to have access to the success of vaccines.
So essentially, we need Taylor Swift to amplify a message, is what I'm hearing.
I heard she might be vacationing with the Kelseys at the shore, so I'll see what I can do.
I'm struck by how fractured it feels we all are as a society, and sometimes even as different medical professions. It's really easy for us to all just operate in our own silos because we're just so busy and we're tired and there's always so much to do. Does this time that we're living through provide any kind of an opportunity for us in medicine to come together?
That is my hope and my vision. I have seen, and across our professional societies, especially the primary care societies, we are talking, our CEOs are talking, our presidents are talking, and our organizations are talking about how do we amplify each other's message and come together as the primary care groups who care for patients all over the country. And so I do think that I think there's hope in this chaos. if we can go through this experience, and this is not the worst thing that's ever happened in the history of our country. There have been challenging times, whether it's a world war or a huge infectious disease outbreak that didn't have a vaccine, whether it's the Great Depression, we have faced, and our families and communities have faced challenges before. And so we will get through this. The question is, how do we watch that beacon, that lighthouse, that beacon of hope, of light at the end of that, and come together out the other side in a better place than we were a couple of months ago, where we are speaking together, collaborating together in partnership with families and communities and others who care about the public's health interest across the country in a way that we really get out of our silos, take some humility and say, we are better if we're working together than if we try to go this alone based on science and in the context of our communities.
Dr. Sue Kressly, thank you so much for spending the time with us. We so appreciate your point of view, your leadership, and your optimism of getting us through this to the next step. Thank you again for being with us.
Thanks so much for having me.